Faced with financial strain from Medicaid redeterminations and the potential loss of patients, rural hospitals across the country are switching their status to continue healthcare services in their communities. MyUP's Jessica Goska investigates how the change could impact Upper Peninsula healthcare workers and patients.
A growing number of rural hospitals are reducing their inpatient beds in the hopes of sustaining services despite financial stress. They're becoming critical access hospitals, a designation that allows Medicare participating providers to perform services on a cost-based reimbursement system and become eligible for the 340B drug pricing program.
There are no negatives in my mind to become a critical access hospital.
My Michigan Medical Center Sioux is one Upper Peninsula site transitioning to CAH status over the next year. It currently operates as a 49-bed rural hospital, but will have to limit inpatient capacity to 25 beds to meet CAH requirements. Annual average patient stays will be capped at 96 hours, a reduction from the center's current 3.5-day average length of stay.
It's my understanding that two of our UP hospitals, being My Michigan Sioux and Marshfield Dickinson, are going to be critical access hospitals. I think the concern is just a decrease in number of beds at those hospitals, where the question is, where are those patients going to go?
Some healthcare workers raising concerns that patients displaced from CAHs will need transfer to already understaffed hospitals like Upper Peninsula Health System Marquette. But Kevin Kalchik says that at least in the Sioux, there's a low probability of that.
We're licensed for 49 beds, but we don't use those 49 beds. We never do. We transfer about 2 patients a day from our community to other locations for a number of different reasons. But My Michigan has their own EMS service up here as well. So we feel more prepared to be able to take care of any high acuity, high census situation.
Leaders at Upper Peninsula Health System Bell, a top-ranking CAH, say they've maintained a robust mix of services with the designation, including emergency care. They note the switch to a CAH could come with changes in service, but in the Sioux, Kalchik assures services provided will remain the same and will not incur delays.
You know, it's hard to accept that when, according to the guidelines, that they're only going to be able to have 25 acute care beds. So as the nurses at UPHS Marquette, we just want to make sure that we have a safe patient load and that we are able to care for our patients in a safe manner. Every patient deserves the very best care.
Read more about the CAH designation requirements and learn about other UP hospitals making the switch at myupnow.com. For MyUP News, this is Jessica Goska.